Okay, top of the hour to everybody. Welcome, welcome. Thank you all for being prompt. And I see the room is filling up, so I'm just going to give it a little bit more time to let more people enter the room, and then we will dive into the material. So just a few more seconds over here. Let more people come in. Fantastic. Fantastic. Almost there. All righty. All righty. Good morning, everybody. Welcome to an exciting class about Medicare. Should you take Medicare? And this is a very important question. There's a lot of money riding on the line over here. So we're going to have a good conversation about this. But before I get into the material, the first thing I want to do is say a thank you to all my members and my clients. I'm sure you guys have heard me say this before, but these webinars do not happen in a vacuum. They happen because there are people who are supporting me and encouraging me. And if anybody here knows somebody who is one of my clients, one of my members, go ahead and give them a hug from me and say thank you, because they're the ones who really keep me in motion. Very much appreciated. Okay, so without further ado, let us dive into the question, should you take Medicare? Now, before I get into Medicare, let me just note that the question really is a strong question for federal employees specifically, because you guys already have health insurance. You already have FEHB. And for those who didn't know, you're going to be able to continue FEHB into retirement. You're going to be able to continue FEHB into retirement. So long as you satisfy what's known as the 5-year rule, you'll be able to continue FEHB into retirement. And not only will you continue FEHB, but the government is still going to make their contributions in retirement. So pretty much what you guys are paying right now for your health insurance, you're going to continue paying that into retirement. Yes, there'll be adjustments for inflation, but pretty much what you are paying right now, you are going to be paying as you get into retirement. So you guys can continue health insurance and the government subsidy even into retirement. So because you guys already have health insurance, it really begs the question, do you need to have an additional health insurance? Do you need to have Medicare in addition to your FEHB, or maybe in lieu of your FEHB? Oh, and by the way, let me just remind you something about your FEHB. Not only will you have FEHB in retirement, you will also have the ability to switch your FEHB in retirement. There's going to be open seasons every year. So that's an opportunity for you to switch your FEHB in retirement. There also are other opportunities for you to switch your FEHB. So for example, if you were to move out of your coverage area, so if anybody here is planning on moving in retirement, then when you move out of your coverage area, that will be an opportunity for you to switch your FEHB. Also, if you ever have a life event, for example, marriage, divorce, birth, death, that's another opportunity for you to switch your FEHB. Also, when you become eligible for Medicare at the age of 65, that's yet another opportunity for you to adjust your FEHB coverage. So you guys have FEHB with the government contribution in retirement, and there's going to be open seasons and opportunities for you to switch. So if you ever are unhappy with the FEHB plan that you have right now, you could always switch to a different FEHB plan. So with all that being said, do you even need Medicare? Let's try to answer that question as much as possible. Before I go further, if I could just ask you guys to chime into the chat box. Okay, I just want to make sure that you guys are able to hear me and see me okay. I see some people are saying that they're having trouble hearing me or seeing me. But I want to make sure that the majority of people here are able to hear and see. So let me just make sure we are all on the same page. If you guys can give me some feedback in the chat box as to whether you can hear me or see me, just want to make sure that we're all good on that. And then I'll go further. All righty. Perfect. Fantastic. Okay, thanks for your feedback, everybody. Fantastic. Okay, so let's move on. Let's make some progress. I don't know about you guys, but I find of all insurances, health insurance is of the most complex, possibly even the most complex of all the insurance. I mean, it's certainly more complicated than life insurance or disability insurance or long-term care insurance, and it's much more complicated than those. Even regarding auto insurance and homeowners insurance, it's more complicated than those, at least in my opinion, as well. So health insurance is already a very complex topic. Then comes along Medicare and takes the complexity to a whole new level. They like making it challenging. So I'm going to help you guys navigate the Medicare system as best as possible. I'm going to share with you guys a lot of the research that I have done. I've read the Medicare websites, the Social Security websites. I've even read through the Medicare brochure. I don't know if you guys have come across this brochure, the Medicare brochure, Medicare and You. So if you guys want, I'll share you a link to that brochure. Here it comes in the chat box. Okay, so if anybody here is interested, you can see the Medicare and You brochure. You can read it up on your own. So I'm going to pass along to you guys the research that I've done. But I'm also going to pass along to you guys the research that my clients have done. Most of my clients are retirees or pre-retirees. And they have skin in the game, let's just say. So they have taught me a lot of the nuances and behind the scenes stuff behind Medicare. So I'm going to pass along to you not just my own research, but my clients in the trenches work that they've done. So let their long road lead to your shortcut. Okay, so let's dive in and let's talk about the different parts of Medicare. So for those who don't know, Medicare's got many parts. There's Medicare A, B, C, D, E, F, G. There's all these different parts of the Medicare. Now, for this class, I'm not going to get into every single part of Medicare. I'm going to be primarily focusing on these four on this slide. So there's Part A, which is the facilities. Part B, which is the practitioners. Part D, which is the prescription drugs. And then there's Part C. Part C, Medicare Advantage plans. Now, just a quick note about Part C. In order for you to have Part C, you must be enrolled in Medicare Part A and Part B. So if you're having Medicare Part C, that means you already are signing up for Medicare Part A and Part B. Okay. Now it's interesting because the Medicare Advantage plans are really not even Medicare proper. They're offered by private companies. And what these private companies have done is they've created their own Part C policies. Those policies have to conform to a basic Medicare guideline. But then each Part C policy adds their own bells and whistles. Like, for example, some Part C plans provide a dental or a vision coverage. Some Part C plans cover you outside the United States of America, which, as we'll see, Medicare is not going to cover you outside the United States of America. Some Part C plans provide a stronger prescription drug coverage. Some of them provide you with additional coverage of what Medicare doesn't fully cover. And some of them even provide a long-term care type of benefit. Okay, it's not exactly long-term care, but it's like this additional benefit which sort of complements and functions a little bit like a long-term care benefit. So there are many, many private companies that offer their own version of Part C. And the Part C costs are going to range. There's going to be some Part C costs which cost like $10 a month, and there are going to be some Part C plans that cost hundreds of dollars a month. So Part C, you're going to have a whole range of Part C. And again, remember, Part C is not really Medicare. It's private companies that have offered their own policies. And in order to have Part C, you have to have Part A and Part B. Now, what's interesting about Part C, just as another additional comment, what's interesting about Part C is that if you choose a Medicare Advantage plan, a Part C plan, FEHB will allow you to suspend your FEHB. I'm not talking about canceling. I'm talking about suspending your FEHB. If you cancel, that's not a good thing because then you'll be out of FEHB for good. But if you suspend your FEHB, then you will be allowed to re-enroll at a future event, whether it's a future open season or whether you lose your insurance coverage. So if you choose to have Medicare Part C, that means you'll have Medicare A, B, and C. Then it's really a question, should you have another insurance in addition to all that? So we're going to talk about whether you should have multiple insurances. Now, let's talk about what Medicare is going to cost you. Medicare is going to cost you something, okay? There's different parts to Medicare, as we just said. So the Part C, the Medicare Advantage plans, that's going to vary from carrier to carrier. But the Part A and the Part B and the Part D, they have their various price tags. First, Part A. So Part A, if you guys can see on this slide, Part A is free. At least for most of you guys. I'm pretty sure every person on this webinar, you're going to get Part A for free. Now, the truth is, I shouldn't say it's free. I should say you're paying for it right now. You know your Medicare tax, 1.45% of your income? That's right. You are paying for Part A. It's not free. You just happen to be paying your way for Part A right now. And this way, when you reach the age of 65, you will not have to pay an additional premium for Part A. There are some people who have to pay for Part A, but it's very, very rare. And again, I don't expect anybody here in this room to have to pay Part A. So Part A, you're paying for it right now. But the truth is, as we will see very shortly, there's another cost to Part A. I don't know if anybody here knows what I'm talking about. There is another cost to Part A. The cost of Part A is that once you are enrolled in Medicare Part A, and the truth is even any other part of Medicare, but even the Medicare Part A, once you are enrolled in Medicare Part A, you are no longer able to contribute to an HSA, a health savings account. Now, if anybody here has been to any of my previous seminars or webinars, you probably know that I am a big fan of the HSA, a big fan of the HSA. And so I would encourage you, and by the way, I'm going to be giving a webinar on HSA in about a month from now. So if anybody here is interested, let's see if I can find the link to that webinar. If I can find it quick enough, I'll share it with you. Okay. Yes, I think I found it. So I'm going to share with you guys in the chat box over here a link to my upcoming webinar. So you guys, if you're interested, you can sign up for that. Okay. Okay. So that is a link to a future webinar. Okay. I'm pretty sure. I hope the link works. If not, I apologize. But there's going to be a webinar on HSA next month. So anyhow, what I'm trying to say is that Medicare Part A is not free. Number one, you're paying for it now. Number two, once you enroll in Medicare Part A, you are no longer able to contribute to an HSA. So you lose the benefits of contributing to an HSA. Okay. Now, whether that's a deal breaker, I would assume that it's not going to be a deal breaker for you guys, but I'm just letting you know that there is a cost to Part A. Then there's a cost to Part B. So if you guys can see on this slide over here, Part B depends on income. And if you look down below, you'll see the Part B and D monthly premiums are on the right-hand side of the slide. And then on the left-hand slide, it really depends on your income brackets. So I have on this slide the 2021 premiums. Now, why don't I have the 2022 premiums? Believe it or not, because they are not yet published by Medicare. I shared with you guys a link to that Medicare and You brochure. It's the 2022 brochure, and they don't yet have the 2022 numbers. I looked at the Medicare website. They don't have the 2022 numbers. It's only the very, very end of October. What else do you want from them? Okay, but nonetheless, they don't have the 2022 numbers, so I am just basing it off. Of the 2021 numbers. Okay, so if you guys can see on this slide over here, your Part B premiums in 2021 will be based upon your income, your modified adjusted gross income in 2019. So again, that's always the case. Your Medicare premiums are always based upon your modified adjusted gross income from 2 years prior. Now, if you guys heard what I just said, you should be outraged. Why? What's so outrageous? I'll tell you what's outrageous. I just said your Medicare premiums are going to be based upon your income from 2 years prior. Why is that outrageous? The reason why it's outrageous is because it could be that now you're retired, but 2 years prior, you were still working. Are they going to base your Medicare premiums in retirement on your income that you were earning 2 years ago while you were still working? And the answer is yes. That's exactly what they're going to do. Yep. Unless you kvetch about it. What do I mean kvetch about it? you need to contact Medicare and tell them that you had a life event. What's a life event? You can't just lie. You can't just make up a life event. What life event did you have? Retirement, believe it or not, retirement is a life event. Your income decreased when you retired. So what you need to do is you need to reach out to Medicare with this form. I'm going to show you guys the form that you could use. Okay. I'm pretty sure this form is up to date, but if you guys could, you could double check. Here's a link coming up in the chat box. Here it comes, here it comes, here it comes. Bang, in the chat box. What I just shared with you guys is the official Vetch Form. This is the form you're going to fill out to let Medicare know that you had a life event, that your income dropped in retirement. This way, they should not base your premiums on your income from 2 years ago, but rather you should base it on your current level of income. If you do not let Medicare know this, they will just charge you based upon your Medicare, based upon your income from 2 years prior. That's just what they're going to do. Okay. So if you guys look over here, you'll see these what your premiums are. So if you see the Part B premiums, this is what it costs per month per person. There's no self plus one plan with Medicare. There's no family plan with Medicare. This is per month per person. So if you're married, take these numbers and multiply it by 2. Okay? And that's just Part B. If anybody here wants Part D, which is prescription drugs, if you want some sort of coverage there, well then, Part D is going to cost you some money. If you guys see in the slide, Part D is going to cost you about $33 a month. And then if you're making too much money, they slap you with an Irma surcharge. I forget exactly what Irma stands for, like income-related monthly blah, blah, blah. I don't even know. Okay. But Irma is an additional surcharge on top of the $33 a month fee for the premiums. And remember, it's $33 a month for each of you, you and your spouse. So if you're going to get Part B for you and your spouse and Part D for you and your spouse, basically add up the Part B and the Part D numbers and multiply it by 2, and that's what you're going to be paying per month per person. Now, I'll give you guys a few seconds to reach for a pay stub. If anybody here has a pay stub, you might want to do some math right now. You don't have to. This is a webinar, so you can do this on your own. But I'm going to tell you what I encourage my students to do and my clients to do. Look at your FEHB premiums, what you're paying right now per pay period. Convert what you're paying per pay period into a monthly amount. And the way you convert pay period into month is you multiply it by 26 and divide it by 12. You don't multiply by 2 because that's not accurate. You multiply it by 26, divide by 12, and that is your monthly premium for FEHB. I want you guys to do the math. If you could do it right now, that would be fantastic. And I'm curious to know which one ends up being cheaper to you on a monthly basis. Is FEHB cheaper or is Medicare cheaper? Now I'll spill the beans. You guys could type your answers in the chat box if you really want to, but I'm going to spill the beans. It's going to depend. It's going to depend on which FEHB plans you have. Some FEHB plans are very expensive. Some FEHB plans are very inexpensive. So depending upon which plan you have, you might find that FEHB is cheaper than Medicare. You might find that FEHB is more expensive than Medicare. Okay, so everybody here should run their numbers, but just keep in mind the difference in cost between what you have and the cost of Medicare. Fine, fantastic. Okay. Now, by the way, before I even go further, these are the prices in 2021. Let me just mention something, that Medicare premiums usually go up with some inflation adjustments. Okay. And I will let you know that recently Social Security announced a 5.9% COLA. That means they adjusted their Social Security benefits for inflation by 5.9%. So I would anticipate that the Medicare premiums as well will likely go up by at least 5.9%. In fact, I've even read articles to say that the Medicare premiums are likely going to jump by over 10% because they have 2 years of adjustments to factor in. 2021 and 2022, or rather 2020 and 2021 have to be factored in to the new 2022 premiums. So there's a very good chance that the numbers on this slide are going to be higher by about 10% in 2022. But again, time will see. Medicare's got to publish their numbers. Okay, now let's get into what Medicare covers, and we will discover that Medicare pretty much covers the same things that you already have, and actually it may even miss some things that you already have. So what does Medicare cover? So you guys see on the slide, this is Part A. Remember, Part A is the facilities. So it covers on the left-hand side, it covers the inpatient hospital care, the skilled nursing facilities, the hospice care, the home health care, all that is included. However, what's not included, check this out. Private room and nurse, not included. A television or a phone in your room, no entertainment allowed, right? Custodial or unskilled care, AKA long-term care. Long-term care, Medicare does not cover long-term care. Now, that's what they'll tell you. But let me share with you something. I have a relative that is a controller of a nursing home. Okay, and he's involved in all the accounting, all the billing, all that stuff. And what he tells me is that Medicare does provide some form of long-term care coverage. However, it's limited. It's usually up to 100 days of coverage. Okay. And also it's after qualifying events. You have to have some sort of qualifying medical event. And if you have the qualifying medical event, Medicare will kick in, but it's limited up to 100 days. And even in the 100 days, it doesn't sound like they cover the entire thing. It sounds like they cover a chunk, but you have to pay some sort of copay along with it. So just be aware that Medicare may chip in a little bit for long-term care purposes, but don't expect it to cover the full long-term care bill. Next, overseas care. Overseas care. Is anybody here planning on traveling abroad or living abroad? Well, guess what? Medicare is not going to cover you abroad. So if you're going abroad, you're going to have some other coverage anyhow. Fine. So that's what Medicare Part A does not cover. Let's come back to what it does cover. And on this slide, I illustrate typical hospital coverage. Again, we're using 2021 numbers because Medicare has not yet published 2022 numbers. Okay. So this is what it looks like in 2021. For every benefit period, that means it's a 60-day window. For every benefit period, you're going to have a $1,484 deductible for each benefit period. And again, in Medicare's language, a benefit period is 60 days. If you go beyond 60 days, then you enter days 61 through 90. There's a copay, $371 daily, which is okay, a little bit on the high side, but it's okay. And then days 91 through 150, you pay $742 daily, which is relatively high. And then the last bullet point, which is really scary, okay? Once you go beyond the lifetime reserve, Medicare pays nothing. You pay everything beyond the lifetime reserve. There is no max OOP. What does that stand for? There is no maximum out of pocket. There's no maximum out of pocket. Now, this word maximum out of pocket is possibly the most important word in this entire conversation. So let's make sure we're clear on what this means, a maximum out of pocket. Every one of your FEHB plans has what's called a maximum out of pocket. That is a catastrophic limit. That is a cap. That means if you had the most catastrophic, disastrous medical year in history, there is a cap. There is a limit to how much you will come out of pocket. That's true for all your FEHB plans. They all have an out-of-pocket maximum. However, Medicare has no out-of-pocket maximum, not on Part A and also not on Part B, as we will see. If we skip to Part B, so Part B, remember, is the practitioners. So that covers the doctors, the outpatient care, the medically necessary services. You got to love that word, necessary. Who determines whether it's necessary? Let's look at what's not covered because apparently it's not necessary. So on the next slide, what's not covered? So eyeglasses and hearing aids. So if you can't see and you can't hear, that's not so necessary, is it? And also many routine physicals and immunizations. There's a whole chunk that is not considered covered. Routine foot and dental. I don't know if anybody here is planning on having any dental work in retirement, but guess what? If you're going to have dental work, Medicare is not going to cover that. Okay, let's come back on the previous slide. How much is Part B going to cost you? As we saw, it depends upon your income. Okay, so there's the monthly premium based upon your income. There is a tiny deductible. $203 is a very small deductible. And then after the deductible, it goes into an 80-20 coinsurance. That means whatever the bill is, they pay 80%, you pay 20%. I was actually giving this class about half a year ago. It was a virtual class, and somebody on the class, they told me that they had a heart condition, a heart issue, and they had a major heart procedure. And they got the letter in the mail that was called the explanation of benefits, and they saw how much the cost was for that procedure. It was over $500,000. Now, thankfully, they had FEHB, so FEHB chopped away a whole big chunk of that, okay? However, imagine a person got a $500,000 bill and they only had Medicare. And again, Medicare would only cover 80%, but you're still on the hook for 20%. What's 20% of $500,000? Again, I'm not sure if the doctors will be able to charge that high for Medicare, but nonetheless, there is no maximum out of pocket. Let me say it again. Medicare has no maximum out of pocket. That means there is no cap. There is no limit to how much your out of pocket exposure is. Okay. Now, let's go a little bit further. There's Part D, prescription drugs. Okay. And here's the information about Part D. There's a premium about $30, $33 a month. There's a deductible, $435. There's coinsurance. There's a famous Medicare gap, which is weird. They have prescription drug coverage on one side, prescription drug coverage on another side, but for some reason, in the middle, there's no coverage, which is really weird. But once you get past that gap, then Medicare will cover all as far as your prescription drugs. You might have a small copay, but in general, Medicare covers all. Okay, now let's go a little bit further. This slide, how to enroll, with your permission, I'm actually going to skip over this slide right now. Okay, I'm going to skip over this slide, except for the very first detail over here, the individual enrollment period. I'm going to go through that quickly. You know what? I guess once I have the slide, let me just go through it quickly. Sorry. Okay, so how do you enroll in Medicare? So first of all, Medicare becomes relevant when you turn the age of 65. As you approach your 65th birthday, Medicare is going to start spying in on you. They're going to be checking to see whether or not you are collecting Social Security or not. If you are collecting Social Security, you will automatically be enrolled in Medicare. Let me say that again. If you are collecting Social Security, you will automatically be enrolled in Medicare. In fact, you'll be enrolled in Medicare Part A and Part B. They're going to mail you your cards. They're going to start deducting your Part B premiums from your monthly Social Security benefit. You are automatically enrolled. Now, once you're enrolled, can you disenroll? And the answer is you can disenroll from Part B, but you cannot disenroll from Part A. Part A is tied to Social Security. If you are a 65-year-old collecting Social Security, you have to have Part A. There's nothing you can do about that. Now, remember what I said. Once you have Part A, it's not free. It costs you, well, remember, it's costing you 1.45% now, but even in retirement, it's costing you your ability to contribute to an HSA account. So it's not exactly free. But you know what? Since you're going to have it when you collect Social Security, I'm not going to tell you to delay Social Security just so you could avoid Medicare Part A. That's not going to be worth it, okay? But just letting you know, especially if there's any CSRs people here on this webinar, for those CSRs people, since you're not going to get Social Security, then you're never really forced to have Medicare Part A. So that's something to consider over there. Okay, that's the individual enrollment period. It's when you turn age 65. If you're collecting Social Security, then you'll automatically be enrolled. If you're not collecting Social Security, then you have to enroll yourself. Okay, if you miss the individual enrollment period, don't worry about it. Every year there's an open season, the general enrollment period. And the general enrollment period goes from October 15th to December 7th, which, by the way, that nicely overlaps your FEHB open season. October 15th to December 7th, that's a nice overlap. This way you could coordinate your Medicare with your FEHB. Very, very good. The last category here is only for people who are going to be retiring at age 65 or later. Okay, if you retire at age 65 or later, you will have a special enrollment period when your active employment coverage ends. Can I ask you guys a question? Is FEHB considered active employment coverage? And the answer is yes, while you're employed. While you're employed, it's considered active employment coverage. But once you retire, FEHB is no longer active employment coverage. And so when you retire, your FEHB, even though you keep it, it's no longer considered active employment. And that's when your 8-month special enrollment period begins. I hope I'm clear about that. I didn't want to spend too much time on the slide because I want to get into the big question. Okay, the big question is, should you even get Medicare? Well, let me introduce you to the other side of Medicare, what I call the big bully. I call Medicare the big bully because at some point they start swinging at you with these threats of penalties. And they say, oh, you're thinking about not enrolling in Medicare? Oh, well, really? Well, we have penalties for people like you. Oh, what's the penalty? Here's the penalty. 10% premium penalty for every 12 months that you could have enrolled but didn't. Listen very carefully. 10% premium penalty for every 12 months you could have enrolled but didn't. So let's say you could have enrolled at 65, but you didn't, and you waited 12 months, and now you're 66, and you decide to enroll at 66. You're going to have to pay whatever the premium is, plus 10% of that premium. If you miss 2 years, you're going to have to pay premium plus 20%. If you miss 10 years, you're going to have to pay premium plus 100%. And the penalty never goes away. Now, let me just comment about something. I know on the slide it says that there's a Part A penalty. That doesn't apply to any of you guys. Because remember, you guys get Part A for free. So because you get Part A for free, you guys don't have to worry about Part A penalties. Even if you take Part A late, there are no penalties for those who get Part A for free. It's only those who have to pay for Part A, which is very few. It's only those who have to pay for Part A. Those are the ones who will have to have a Medicare Part A penalty. But nobody else here has to worry about the Medicare Part A penalty. Okay? So basically, Medicare starts threatening you with these penalties. And that gets people very, very scared. Oh no. They're gonna start charging me penalties. I don't like that. Do you need to be scared of this big bully Medicare? I have two reasons why you guys, federal employees covered by FEHB, don't really have to be scared of the big bully. What are my two reasons? Here are my two reasons, okay? First reason is penalties don't apply if you're still employed at the age of 65. Penalties don't apply if you're still employed at the age of 65, okay? So if anybody here who is still going to be employed for federal government and you're still going to be covered by active employment coverage at the age of 65, guess what? Medicare can't even threaten you with penalties. They can't even threaten you. Not only can they not threaten you because you're covered by your active employment coverage, you know who else they can't threaten? Your spouse. Even if your spouse is retired. But if your retired spouse is covered under your active employment FEHB, Medicare can't even threaten them or you. None of them. Right? They can't even threaten you guys. If you're covered by active employment coverage or your spouse is covered by your active employment coverage, Medicare can't even threaten you. Now, I say they can't threaten you, but they will threaten you. Yes, they will. They send you letters in those mails, and I'm sure some of you have gotten those letters by now, and they're very pushy. Those letters that they send in the mail, all they talk about are the penalties. They remind you like 3 or 4 times in one letter about penalties. And it sounds very scary. It sounds very intimidating. They make it seem like you don't really have a choice in the matter. Let me set the record absolutely straight. You could completely ignore those letters. Those are empty threats. They cannot penalize you. They can't accrue any penalties against you if you're covered by active employment coverage. So that is number one, why you don't have to be so scared of the big bully, because while you're employed, while you're covered by active employment coverage, penalties don't accrue against you. That's number one. However, there's another reason why you don't have to be scared. And that is because look at the name of these penalties. You see what they're called? They're called late penalties, meaning they are penalties for being late. But if you never enroll, well then, you're never late, are you? I'm not joking. I'm not joking. If you never enroll, you're never late. And if you're never late, they'll never charge you late penalties. So if you just suffice with your FEHB and you never enroll in Medicare, you'll never have to pay a late penalty. So once again, let's return. So if you already have your FEHB, do you really need both FEHB and Medicare? Wow, that's a good question. I already have FEHB. And let's look at this slide. Do you need both? By the way, the words on this slide, almost all the words on this slide are from OPM's website. The first bullet point is my words, actually. The first bullet point is my words. The first words is Part A is free. So if it's free, take it. Hey, if it's free, I'll take 2 of them. But remember my warning, okay? That's why I say actually not so fast. Because even though Part A is free, it's not exactly free. It costs you the opportunity to participate in HSA. But again, my assumption is that most people in this class are going to be collecting Social Security by the time they turn age 65, in which case you're going to have Medicare Part A, whether you like it or not. There's nothing you can do about it. Okay? Fantastic. Fantastic. Okay, so that was Part A. Those were my words. But now the next words on this slide are from OPM. Okay? Generally, FEHB plans cover the same expenses as Medicare. Let me say that loud and clear. I think you guys heard it, but let me say it again. In general, the FEHB plans will cover the same expenses as Medicare, meaning whatever Medicare covers, usually FEHB covers that, and vice versa. I'm sure you guys have noticed this before. When open season comes, and open season is coming up very, very soon. So when open seasons come, you guys are going to see like a dozen or 2 dozen FEHB plans. Have you ever noticed that in general, they cover the same things? You're right. There are some exceptions. There are some details of exceptions. That's true. I agree. But in general, they cover the same thing. That's true for Medicare and FEHB. In general, they're covering the same thing. So if they're covering the same thing, why should I pay 2 premiums for a duplicate coverage? Why should I do that? Okay, that's a very good question. We're going to come back to that. Then look at the third bullet point on this slide. Medicare may cover some of the costs that FEHB plans may not cover, such as deductibles, coinsurances, and charges that exceed the plan's allowable charges. So what this means is that if you have Medicare with your FEHB, whatever your FEHB plan doesn't pick up, Medicare very often, not always, but very often will pick it up. Whatever your FEHB plan didn't pick up, Medicare usually pick up. And vice versa. Whatever Medicare doesn't pick up, very often, not always, but often your FEHB plan will pick up. So it turns out that if you have both insurances, if you have FEHB and Medicare together, then the result of having 2 insurances is that whatever the first one didn't pick up, the second one usually does pick up, and your out-of-pocket goes to 0 or very, very low. That's a very important detail there. Very important detail. Okay, now let's go a little bit further. FEHB plans provide coverage for emergency care outside the United States, which Medicare does not provide. So as we said, anybody here who plans on traveling or living abroad, Medicare is not going to cover you. So FEHB will probably be your best bet. By the way, does FEHB cover you abroad? Does FEHB cover you if you go traveling? And the answer is some of the plans do. There are some FEHB plans that have a very large network that are even accepted outside the United States. Now, they're probably not accepted in every country, but there are many countries that participate in the FEHB, in the American insurances and the American channels. So yes, some FEHB plans do cover you outside the United States. Okay, next bullet point. FEHB plans cover dental and vision, or some of them provide a dental and vision benefit. Medicare is not going to cover you for dental and vision. Last bullet point. Medicare covers some orthopedic, prosthetic, which some FEHB plans may not cover or only partially cover. So you will see some FEHB plans do more coverage, some FEHB plans do less coverage. So let's get this straight. I'm going to try to get you guys to answer this question for yourself. According to what we've just said on this slide, FEHB and Medicare, they pretty much cover the same thing. Again, there might be some details, and you could check whether those details are very applicable to you or very relevant to you. But we're talking about like the common things, even the uncommon things, such as, cancer or heart attacks and stuff like that. These are things which are also provided. These are also covered by Medicare and your FEHB. So in general, if you have both FEHB and Medicare, you're paying two premiums for duplicate coverage. So let me ask you guys to answer this question as to whether you need both. My first question for you is, are you guys happy with FEHB? Usually the answer is yes. Most federal employees are happy with FEHB. My next question, if you ever were unhappy with your FEHB plan, could you switch to a different FEHB plan? Yes. During open season, you could switch to an FEHB plan during open season. And don't you have open seasons in retirement? Yes, you will have open season retirement. So let me be very clear about this. You're happy with your FEHB. If you're ever unhappy with your FEHB, you could switch to a different plan within FEHB. And you'll have the ability to switch plans during open seasons every year in retirement. So if you're happy with your FEHB and you can always switch to a different FEHB, then what in the world am I missing? Then why all of a sudden, when you turn age 65, all of a sudden you're like, I don't know. I just don't know what to do. Why? What changed? What changed? Just yesterday you were fine. And then all of a sudden, I don't know, Stephen. I'm not sure. Did something change about your FEHB? I understand Medicare started threatening you. But did something change about your FEHB when you turned 65? Believe it or not, something does change about your FEHB when you turn age 65. Check this out. Here's what changes. What changes with your FEHB when you turn age 65 is on the bottom of this slide where it says non-enrollment. But in order to appreciate the bottom of the slide, let's go to the top of the slide. So whenever you have two insurances, and this is true for any two insurances, anytime you have two insurances, there has to be something called a coordination of benefits. One of those insurances is established as the primary coverage, and the other insurance is established as the secondary coverage. Now, whenever you have primary versus secondary, can you guys tell me, whenever you have primary and secondary, which one usually picks up the bulk of the bill? Is it the primary that usually picks up the bulk of the bill? Or is it the secondary that usually picks up the bulk of the bill? Which one usually picks up the bulk of the bill? And the answer is the primary usually picks up the bulk of the bill. The secondary, they pick up whatever crumbs fall through the cracks. Okay? This is true for every primary, secondary. Usually the primary picks up the bulk, and whatever falls through the cracks, that falls to the secondary. Okay, so now that primary secondary relationship, let's apply that to FEHB and Medicare. Which one is primary? Which one is secondary? As you can see on the slide, it depends. It depends while you're employed versus in retirement. While you're employed, your active employment coverage is primary. So FEHB is going to be primary, Medicare is going to be secondary. However, once you retire and you no longer have FEHB as active employment coverage, you still have FEHB, but it's not considered active employment. So then when that happens, Medicare becomes primary, FEHB becomes secondary. Now let's remember, who picks up the bulk of the bill? The primary. Who picks up the small crumbs? The secondary. So when FEHB becomes the secondary coverage in retirement, when FEHB becomes the secondary coverage, they're going to be the secondary. They're going to only be picking up the crumbs. They're going to have a fraction of their prior responsibility. When FEHB becomes the secondary and they have a fraction of their responsibility, are they going to lower their premiums for you? Are they going to charge you less in premiums? No, they're still going to charge you full premiums. Can you imagine how excited they are as they see you approaching the age of 65 when you're about to take Medicare, Medicare is going to be your primary and FEHB is going to be in the secondary. They're still going to charge you full premiums, even though they're going to have a fraction of the responsibility. They are giddy with excitement. But could you imagine how profound their disappointment is when you reach that age of 65 and you're supposed to take Medicare, but you decide, nah, I'm just going to stick with my FEHB. What's FEHB's response to that? No, you were supposed to take Medicare. We were supposed to be in the secondary seat, charging you full premiums, even though we have a fraction of the responsibility. Oh, man. They are profoundly disappointed. And guess what? They have a recourse. What's their recourse? Check out the bottom of the slide over here. Listen very carefully to the language, okay? What's the recourse? If you don't take Medicare, if you just stick with your FEHB, what's their recourse? Here it comes, okay? So, retirees over the age of 65 who do not have Medicare, that means you just have FEHB. FEHB plans will pay the hospitals, Part A, and physicians, Part B, based upon Medicare rates. Medicare rates. Ooh. What does that mean, actually? What does that mean, they start paying based upon Medicare rates? So let me explain what this means. Most of my clients, and I'm assuming most of you as well, most of you go to doctors that accept your insurance. I think that's a fair assumption. I know that there's some people who don't, but most of you go to doctors that accept your insurance. Do you know what it means that your doctor accepts your insurance? It means that your doctor has entered into a contract with that insurance company. And the contract clearly states that any card-carrying member of this insurance plan, the doctor can only charge them a pre-agreed upon schedule of rates. Okay, I'm sure you guys know exactly what I'm talking about. Have you ever gotten one of those letters in the mail called an explanation of benefits? Have you guys ever gotten one of those? Okay, so you open the envelope and you read it. It tells the tale. What happened was you went to a doctor for a paper cut. The doctor wanted to charge you $1,000 for the paper cut. But the insurance said, no, it's only reasonable and customary to charge him $100 for the paper cut. So that means they could only charge you $100, not the $1,000. What happens to the $900 difference? Could the doctor send you a bill for the balance? And the answer is absolutely not. It's illegal. It's a breach of contract to balance bill. The only doctors that could balance bill you are the out-of-network doctors. They could send you a bill for the balance. But if you're an in-network doctor, you cannot charge them the difference. That will be a breach of contract. It is totally illegal for the doctor to do that. Okay? So, whatever the rates are that were pre-agreed upon by the insurance company, if the doctor accepts your insurance, that means that they accepted that pre-agreed upon schedule of rates for whatever the services they provide. Every insurance company has a schedule of rates, every one of them, including Medicare. Medicare also has its schedule of rates for the same services. Can anybody guess which schedule of rates pays the doctors more favorably? That's right. Do you think it's the commercial plans, the FEHB commercial plans, or do you think it's the Medicare public plan? Which one do you think pays the doctors, right? Which one do you think pays the doctors more favorably? And the answer is FEHB pays the doctors more favorably. Medicare does not pay favorably. Medicare actually pays them much less, so much less that the doctors are looking at the situation and they're like, wait a second, I have two clients and I'm providing the same exact service for these clients. But for one client, I get paid the larger amount. And for the Medicare client, I get paid so much less. You know what? I'm not seeing Medicare patients anymore. I'm not interested. And you know what? I totally understand where they're coming from. I totally understand. It's a business decision. They're doing the same amount of work, but they're getting paid much less with Medicare. I totally understand why there are doctors, many doctors, that are opting out of Medicare. They're just saying, I'm not interested. I'm not interested in Medicare. Aha. So listen very carefully again. Let's read the bottom line over here. Okay. Retirees over the age of 65 who do not have Medicare. So if you have FEHB and you don't have Medicare, what's going to happen? So, as the slide says, your FEHB plans will pay the hospitals, Part A, and physicians, Part B, based upon Medicare rates. Medicare rates. That means the hospitals and the physicians are going to start being paid less by your FEHB. Oh my goodness. Who does that impact? If your doctors start getting paid less by FEHB, who does that impact? Okay. So the direct answer is your doctors. Your doctors are directly impacted in this. They're going to get paid less. Does that in turn impact you? If your doctor starts getting paid less by your FEHB, does that in turn impact you? And the answer is, I know some of you are probably thinking, yeah, actually, maybe it does. But actually, I don't think it's going to impact you. Because here's the thing. Your doctor can't stop seeing you. He can't just pick you out specifically and say, you, just you. I'm not seeing you anymore. He can't do that. In order for the doctor to stop seeing you, they have to stop seeing everyone who carries the same insurance as you. So everyone who is under your line of insurance, the doctor has to stop seeing every one of them, not just you. Now, there are some lines of insurance that represent a very small piece of the doctor's business, like 1%, 2% of the doctor's book of business. So maybe they'll be okay dropping that line of insurance. But there are other lines of insurance which represent 10, 20, 30% of the doctor's book of business. Like, for example, Blue Cross Blue Shield. Which doctor in their right mind is going to stop accepting Blue Cross Blue Shield? They'll be shooting themselves in the foot. Why would they do that? So let's say it again. You guys have FEHB. Are you happy with your FEHB? Yes, you are. If you ever were unhappy, could you switch to a different FEHB plan? Yes, you can during open season. Are there going to be open seasons for the rest of your life in retirement? Yes, every single year for the rest of your life, there'll be the chance for you to adjust your FEHB. So if you're happy with your FEHB, and you could always adjust to a different FEHB, then what happens at the age of 65 that you start second guessing yourself and stressing? Does something change about FEHB? We said something changes, but that impacts your doctors. It doesn't impact you. It impacts your doctors. Oh, so if it doesn't really impact you and you're happy with FEHB, do you need to also have Medicare? Do you need both when you already have coverage? So here's the answer, guys. Are you ready? Here's the punchline. Here it comes. Here it comes. Do you need both? I have two answers. Answer number one. Do you need both? No. No. You don't need it. You already have coverage. You already have coverage. You have FEHB coverage. If you have Medicare, remember, Medicare pretty much covers the same thing as FEHB. So why would you pay two premiums for duplicate coverage? So, do you need both? Answer number one is no. You don't need both. That's answer number one. Now for answer number two. I'm going to answer the question with a question. Is there a benefit to having both? Is there a benefit to having both? And the answer is, actually, there could be a nice benefit to having two insurances. Because remember the primary, secondary? Whatever the primary doesn't pick up, usually the secondary does pick up. And if the secondary picks up what the primary didn't pick up, your out-of-pocket goes to zero. Zero. Or at least very, very low. So there is a benefit to having both. The benefit to having both is that your out-of-pocket goes down to close to zero, if not zero. Oh, so we have finally arrived at the crux of the question. The question isn't just, should I have, Medicare? The question really is it worth it to pay a second premium just to avoid my out-of-pocket exposure? And in order to answer that question, I have to know two pieces of information. Number one, how much is that secondary premium? And number two, what was your out-of-pocket exposure without the second insurance? Remember, all of your FEHB plans have that out-of-pocket maximum. Out-of-pocket maximum. That means if you have FEHB by itself, there's a catastrophic cap. There's a limit to how much can come out of your pocket. It's not like you have unlimited exposure. You have a very defined, very limited exposure. And some of the exposures are super low. Some of the exposures are $10,000, $8,000, $7,000, $6,000, $5,000, $4,000. Again, it's going to vary depending upon which FEHB plan you have. So if you guys are hearing me, you could buy an FEHB plan with a super low out-of-pocket exposure. So let me give you an example. I'm actually going to give you guys two examples. Listen very carefully to these two examples, okay? Example number one, my Medicare premiums for me and my spouse, my Medicare premiums are going to be $5,000 a year. Let's just say those are the case. $5,000 a year for my Medicare premiums. My FEHB plan has an out-of-pocket maximum of $5,000. Please tell me, is it worth it to pay $5,000 in Medicare premiums just to avoid my $5,000 FEHB out-of-pocket maximum? Is that worth it? Is it worth it to pay $5,000 in Medicare premiums to avoid my FEHB out-of-pocket maximum of $5,000? Is it worth it? And the answer is no. No, it's not worth it at all. Now, 1 second. Why is it not worth it? Isn't it like a wash? It's like a wash. It's 6 of one, half a dozen of the other. It doesn't make a difference, does it? And the answer is no, it's not worth it at all. Why? Because your Medicare premiums is a guaranteed $5,000 expense. Your FEHB out-of-pocket is not guaranteed. It's only if you have a large enough medical event that reaches by that $5,000. Why would I pay $5,000 in premiums just to avoid an iffy maybe $5,000 out-of-pocket maximum? Why would I do that? So in that first example, no, it's not worth it at all. Now for my second example, check this out. Second example, my Medicare premiums are $5,000. My FEHB out-of-pocket maximum is $15,000. Is it worth it to pay $5,000 in Medicare premiums to avoid my $15,000 out-of-pocket exposure? That's a tricky one. That's a tricky one. And the answer to that is, it really depends on your relative health. Like if you're relatively healthy, you know what you could do? If you're relatively healthy, you could skip out on Medicare. And the $5,000 in premiums? You could save those $5,000 in premiums. And guess what? After 3 years of Medicare premium savings, after 3 years of saving Medicare premiums, you have accumulated $15,000, which was your out-of-pocket exposure. So after just 3 years, you have already had enough savings to cover your out-of-pocket exposure. Oh, and you only have to worry about your out-of-pocket exposure 1 year, just 1 year. You know why? Because if you see your health has declined and you're going to have recurring medical expenses year after year after year, guess what you could do during open season? You could switch to a different FEHB plan during open season, and you'll have the ability to do so every year for the rest of your life. Wow, this is unbelievable. Are you guys seeing this? Basically, the decision as to whether you should have Medicare with your FEHB boils down to your willingness to self-insure on your out-of-pocket exposures. If you have FEHB alone, you'll have out-of-pocket exposures. Who's going to cover those out-of-pocket exposures? Well, isn't that what you're doing right now? don't you have FEHB now without Medicare? And aren't you covering your out-of-pocket exposures right now? You already are self-insuring on your out-of-pocket exposures. I'm not even telling you a new strategy. This is something you've been doing your entire life. And you could continue to self-insure, knowing that there's a catastrophic limit, and you could control the catastrophic limit. You could choose an FEHB plan that reduces your catastrophic exposure. So, for many people, choosing to self-insure and going with FEHB and not buying Medicare as a secondary insurance, that could save you multiple thousands of dollars a year, year after year, for the rest of your life. But at the end of the day, it comes down to your willingness to self-insure on your out-of-pocket exposures. I know it sounds scary, but when you have the ability to control the out-of-pocket exposures with the FEHB plan, it actually is not as scary. You can see the limits, you can see what your catastrophic exposure is, and you can see whether or not you feel comfortable self-insuring on that. I hope I'm making sense over here, guys. Okay, so let me open the floor to some questions. I know I wanted to get into TRICARE a little bit, but just because we're going overboard, TRICARE is mandatory for people who are age 65. If you want to continue TRICARE, you're going to have Medicare Part A and Part B. And very often I see the TRICARE people, they just go with the TRICARE Medicare Part A and Part B combination, and they suspend their FEHB. Okay, so let's open the floor to some questions. Okay, I see that Stephanie has a question. Does health savings accounts apply in retirement? Do HSAs apply in retirement? The answer is yes. Yes. Two things. One, you could contribute to an HSA in retirement, and you can even access the money in retirement. Okay, so yes. Alfred has a question. When I take Social Security at 66 while still employed on FEHB, am I going to be automatically enrolled in Part A? Yes. How do I decline Part B at that time? So when you apply for Social Security, Alfred, part of the application, there's a section where they'll ask you if you wanted to, if you want to have Medicare, or if you want to opt out of Medicare. They're going to have that as part of the Social Security application. Tina is asking, aren't there out-of-pocket costs annual and lifetime? So there is, if you're talking about with Medicare, there's no out-of-pocket maximum. There's no out-of-pocket maximum. But if you're talking about with FEHB, there's an out-of-pocket maximum. That's what we're talking about. That's the punchline of my presentation. That's exactly correct. Bruce is saying, so how does this work if you are still working at age 70? So Bruce, if you're still covered by active employment coverage, you could ignore the big bully, ignore them while you're working. And then once you retire, it boils down to your willingness to self-insure. But as I reminded you, you already are self-insuring. So it's nothing different. So Simone is asking, they enroll you in Part A before you take Social Security. So Simone, no, you have to manually enroll yourself. If you're not taking Social Security, you have to enroll yourself. But if you are collecting Social Security, then you can enroll. I'm sorry, but then you're automatically enrolled. Ira is asking, is there a benefit in switching to high deductible FEHB and enrolling in Medicare? So Ira, if you're going to have both FEHB and Medicare, if you're going to do both, which again, I'm not saying that you need to do both, but if you decided to do both, yes, I agree with you. You might as well choose a high deductible plan in FEHB because it's going to be cheaper, and they're going to give you extra money towards your Medicare or towards your out-of-pocket expenses, right? So yes, that is a good. If you're going to have both Medicare and FEHB, then the way to do it is having Medicare with a high deductible plan. That is usually the best strategy. But who's to say that you even need to have both? I see a very long question over here. Let's see if I could address this. I've been in an HDHP, the HSA, the last couple of years. Last 2025. Although we reached care. She has to spend a lot about business. We feel like we need to get out of our HDHP 22. So, Alfred, I would tell you the following. It could be that the HDHP plan has what's called a high out-of-pocket maximum for you. Maybe check out some of the HDHP plans that have lower out-of-pocket exposures. I would check that out. And you're right. If ultimately you're coming up with major medical expenses and the high deductible plans don't have low out-of-pocket exposures for you, you might want to switch to a different FHP plan that has lower out-of-pocket exposures. But Alfred, you have to double check because it could very well be that the reason why you're having out-of-pocket expenses right now is because no insurance is going to cover what your family member needs. So double check. I can't say for sure. I'm not sure the circumstances, but double check. Tina's asking, as a CSR's employee, I currently contribute to FSA, but can't when I retire. Can I contribute to HSA during retirement? Tina, yes, you can do HSA when you retire. Bill, how does Part A and FEHB interact? So, Bill, if you have Part A and FEHB, that means for the hospitals and the facilities, you have two insurances. You have Part A and FEHB. That means you have two insurances, and there has to be what's called a coordination of benefits. One of them is going to be primary, one of them is going to be secondary. While you're at work, FEHB is primary. When you retire, FEHB is secondary. Okay, but remember, you'll only have two insurances for the facilities, for the hospitals and the other types of facilities. For the practitioners, you only have one insurance, your FEHB. Okay, Carrie's asking, I'm retired from federal service, but not on Social Security. I own a consulting business, and we each earn $100,000, which we pay Social Security tax and Medicare tax. By the way, Carrie, if you're earning $100,000 and you're paying Social Security tax on all 100, that means you have to speak to an accountant. There are ways around that, Carrie. So if you could actually, you could probably minimize the amount of the tax you're paying on that $100,000. So Carrie's asking, am I still employed for the purposes of Medicare penalty once I turn 65? So actually, Carrie, you're not. Okay. In order to be covered by what's called active employment coverage, your employer, okay, even though you're self-employed, your employer will have to provide coverage. I believe, I don't know, don't quote me on this. I think it's for at least 50 employees. Your employer has to have at least 50 employees. If they don't, then it's not enough to be considered active employment coverage. Okay. Okay, fine. Madeline's asking, I am still working at 65, going to work till 70. I enrolled in Medicare A only. Okay, good. There you go. Arden, I somehow remember that Social Security is required at 70. So Arden, Social Security is not required. You could even delay beyond age 70. Madeline, should I disenroll? Madeline's asking, should I disenroll in Medicare Part A? So, Madeline, if you are collecting Social Security, you cannot disenroll. If you're not collecting Social Security, you could disenroll. And this way you can do the HSA. But, Madeline, if you're not doing the HSA, then there's no reason to disenroll. Okay? Can I take Social Security at 70 and still work? Yes, you can. Okay. Marika's asking, FEHB pays Medicare rates when you hit 65. So low premium FEHB is desirable then? So if what you could do, when Marika, you could check at the high deductible plans at any point, whether you're 65, whether you're 62, whether you're 71, I don't care. You could choose out the lower FEHB, the lower premium FEHB plans at all times. You don't have to wait until 65. David is saying, some FEHB plans offer $800 if you have Part B. Yes, some of them do. But guess what? If you choose the high deductible plans, they will offer you either $900 or $1,500 or $1,800 or $2,400 of money that you could spend on not just Medicare, but on your other things as well. Karen is asking, how can HSA contribution be made during retirement? So Karen, you just send money from your bank account to your HSA, and then at the end of the year, you claim the above the line tax deduction. So you might not feel the tax benefit immediately, but when you file your taxes, that's when you'll feel it. Mike is asking, is it true that you can't contribute to HSA when you're getting Social Security? That is true, Mike, because once you have Social Security, no, Mike, it's actually not accurate. If you're 65, it's accurate. But if you're 62 through 64, then it's not accurate. So if you are 62, Mike, and collecting Social Security, you could still do an HSA. But once you turn 65, you cannot. Okay, Jay is asking, how is annual income computed? I see you have a lot of questions, guys, so I'm going to have to cut it out. I'm going to have to cut short soon. How is annual income computed when determining cost of Part B? It's your modified adjusted gross income. It includes your federal pensions. It includes your Social Security. It includes those things. Yes, it does. Yes, it does. Private question. My wife and I have an FEHB plan that pays 90% of both our Medicare Part B premiums and the monthly FEHB costs. Okay. It's a plan specifically for FEHB employees who have both. Yes. Okay. I know there are some plans like that. I think Aetna has a plan like that. And maybe like two other things have something like that. So yes, that is possible. Okay. Okay. It's a United Healthcare plan. Okay, good. Tracy's asking, if I get married to somebody already on Social Security and Medicare, can he opt out of Medicare and get on my FEHB? So if they're collecting Social Security, they have to have Part A, but they could opt out of Part B. They could opt out of Part B. Woo! That was a mouthful, and I know I kept you guys overboard. Okay, so I hope that this class was informative to you guys. I would love to be a resource to you. Again, this class does not happen in a vacuum. It happens because I have people supporting me. I have my clients. I have my members. I encourage anybody here, if you know a client or member, go ahead, give them a hug. And if you yourself want to become a client or a member, you could always send me an email, and I could give you some more information about how to do so. Okay, my email address, I'll put it into the chat box right over here for you guys to see. My email address here comes in the chat box. Bang. So anybody here is interested in learning more about becoming a client or learning more about becoming a member, I could share with you guys that information. Just send me an email and I'll show you how to sign up. All right, everybody. Great connecting with you all. Don't be strangers. Keep in touch. Send me emails. You can try call me as well, although probably email will probably be the most efficient way to do it. But really stay in touch, and hope to see you at my next webinar, which is going to be in November sometime, about the HSA versus the FSA. Okay. All right, everybody. All the best. Blessings to you. Take care. Have an amazing day. Signing off.